Hello everyone, I'll be talking about atrial fibrillation today. Atrial fibrillation is a condition where the heart rate goes very fast beyond 200 and suddenly the upper chamber of the heart starts quivering or fibrillating. There is stasis of blood, there is stagnation of blood, and small blood clots can form, go directly into the brain, cause a brain stroke, go directly into a heart, cause a heart stroke, go directly into the kidneys and cause a kidney infarction. The treatment for atrial fibrillation with strokes is to give blood thinners. Many times people do not tolerate the blood thinners. Either they are bleeding with blood thinners or there is failure with blood thinners, in the sense that patients who are on blood thinners still end up having a stroke. Good old days, the treatment for this used to be left atrial appendage closure or cutting of the left atrial appendage. What is a left atrial appendage? It is a small structure in the left atrium on the left side of the heart where all the blood clots get accumulated. So now a new procedure which is there, which we are doing, is called as left atrial appendage occluder, wherein we close the left atrial appendage totally. All the blood clots get housed there and then later on get broken down into smaller particles, and thus preventing a brain stroke or a heart stroke, and the patient need not be on blood thinners. This is very good news. Atrial fibrillation patients need not be on blood thinners if you have this left atrial appendage occluder device. How we go about it? We take a little wire, and the wire basically goes from the femoral vein or from the leg artery, and once it is gone from the leg artery, under X-ray guidance, it reaches the heart, and once it reaches the heart, it goes from the right atrium, right side of the heart. We pierce it and it goes into the left side of the heart, and you see this catheter which is piercing and crossing the left side of the heart, and then the left atrial appendage, the device is released. This is the appendage which is there, which all the blood clots get housed. Once the appendage is released, the device is released in the appendage. It is a permanent solution. It is an MRI compatible solution device, and permanently all the clots get housed in the left atrial appendage, and the device prevents the embolization or breaking up of the device into the other areas. And this is a boon for patients who cannot tolerate the blood thinners or in whom the blood thinners, there is a failure of blood thinners. How did we approach the left atrial appendage occluder device? We went through one of the leg veins, reached here into the left atrium, and then there is a transesophageal echo probe which you can see, which is showing us the heart, and this is the left atrial appendage. You can see the device which is going across. This is the portion of the left atrial appendage where the clots are housed, and you see very clearly this is what the left atrial appendage looks like. After location of the left atrial appendage and sizing it up, we went with the device. This is what the device looks like. This has got a butterfly wing on the top and the disc at the down. And here we are trying to see whether the device is totally occluded the appendage or not. And once there is no flow into the appendage and the appendage is sealed off permanently, the device is released gradually. And once the device is released gradually from the disc, you see the connector cable. The connector cable is releasing the device slowly, and after that in the body only the device is left, and this is what the device looks like, and everything else has come out. And final show of the device, where this is a permanent solution for atrial fibrillation, MRI compatible. This does not require any blood thinners even if you are having atrial fibrillation.